Ketamine-assisted psychotherapy is becoming a mainstream method of treatment for mental health. I'm here today with Dr. Tiffany Sauls from Asheville Integrative Psychiatry, a leading expert in this field. Dr. Sauls, let's start today with just a basic explanation. Why don't you get us started with what's ketamine therapy?
Ketamine-assisted therapy is using a medicine in conjunction with therapy to address mental illness. And that can be for depression or trauma, addiction, eating disorders, a wide range of mental health issues.
Okay. And so how is ketamine currently being used in your practice?
Yeah, so ketamine, there's a few different routes of administration with ketamine. So what you may have heard of is an infusion center. And so that's IV ketamine used primarily for depression. That's without any therapy. And so at our practice, we use sublingual, so like a dissolving lozenge that you hold in your mouth, and we use intramuscular therapy.
That's an injection, right?
Yes, injection. We administer ketamine to clients who are undergoing therapy for a wide range of conditions. The patients will sit with a therapist throughout their session while they're under the influence of the medicine, of the ketamine. And then those experiences happen, they last about 2 to 3 hours. And then after those sessions, we provide integration for the medicine experience.
Okay. So to be clear, though, ketamine is considered a psychedelic medicine, right? And that's why we've got a longer period of time and some more attention around the treatment. Is that right?
Yes. Yeah.
And so are there things that people misunderstand about psychedelic therapy in general?
So psychedelic-assisted therapy includes medicines such as ketamine, which is one of our only legally available psychedelics. And then there's MDMA and psilocybin, which are both still in clinical trials. And so I think there is maybe a misunderstanding that all of those are widely available or accessible, and that's not the case. What we have right now is ketamine to work with. And I guess the other thing to consider is that ketamine-assisted therapy is a really highly structured treatment with appropriate screening to see if patients are going to be a good fit medically and psychologically, and then appropriate support from a therapist. And so ketamine-assisted therapy could be, 20 hours of intensive therapy over the course of weeks. And it's not just a one and done, and it's not for everybody.
There does seem to be a wide range of conversations out there about people using ketamine for all different types of things. Could you tell me a little bit about which patients benefit the most from ketamine-assisted psychotherapy?
So most of the research in ketamine is for depression. So treatment-resistant depression, particularly clients who are suffering from severe symptoms and suicidality. And in those cases, ketamine infusion centers, where clients can go and receive multiple infusions over a short amount of time, that can be incredibly effective for treating depression and suicidality. And so what we've done here with ketamine-assisted therapy is based our model somewhat off of that, but opened it up in order to provide time for processing and integration to address underlying root cause issues for depression. And in so doing, we also have opened it up to provide make it easier for clients who are dealing with addiction or OCD or eating disorders or trauma to also process and work through some of the underlying issues that have created those disorders and diagnoses.
So understanding that there are differences between the ways that it can be used for some acute conditions versus some that require maybe some more interaction and longer treatment periods, that seems to be the way that the ketamine-assisted psychotherapy structure is working best here. What is the experience like for the patient? How would they describe it? Or maybe you could describe it.
Well, to start with, we have patients meet with our nurse practitioner to do a med psych screen. And so we screen patients to make sure that they're medically appropriate and don't have any mental health history that would make them not a great candidate for working with ketamine. So that would be like history of psychosis, active mania, active addiction. But we screen up front to make sure that patients are appropriate. And then after getting through that appointment, we connect clients with a therapist. And so they start working with a therapist. They do an intake, establish rapport, trust building. There's one more session of preparation to work with the medicine, and that's primarily like what we call flight instructions. But how do we work with these medicines, and how do you want to go into this work? And in those instructions, we ask people to approach this with a beginner's mind and curiosity. Just allow things to come up. Trust this process. Trust your guide, your therapist. And so a lot of that information is given prior to the medicine session. And then the next thing that happens is a medicine session. And so that's on site here, lasting for 2 to 3 hours. We open up enough space, so three hours for clients and therapists to really prepare. So you get on site, you set up your space. You might have brought some items that are meaningful to you, set some intentions, and then you would take medicine. And medicine can be, that could be like I said, sublingual earlier, or an intramuscular injection. And after that, most clients will put on some eye shades, lie back. There's music playing, a curated playlist to support the experience. And then usually that state, when the medicine's working, can last anywhere from like 45 minutes to 2 hours, depending on dose and just how everyone metabolizes. And during that time, there could be a lot of silence. The therapist may just be sitting there and holding space for you. Or there may be information coming up that you want to share with your therapist. And but most of the process is really internal at that point. So clients are going through this internal process where we also like to help people understand that there's an inner healing intelligence that we all have. And by using these medicines, we help people access that inner healer. And so that's part of what's going on during that time. And then as you come out of the medicine session, your therapist may offer back some of the content to discuss there, at the end of your session, or the next day during integration. You can integrate what was coming up in your experience and integrate it into your daily life.
Okay. There's a lot that happens in those sessions, and I'm, personally aware. I've been through it, and I really, had a very profound experience here, and it's hard to put it to words, so I appreciate your explanation on that. When you look at how ketamine-associated psychotherapy, works in whole, but how would someone think about fitting that into an overall treatment plan? Most people, I would assume, that are coming here that have a history of depression or some other mental wellness issue that they're trying to approach have probably been working at it, and they've probably been working at it with someone else. Maybe they feel stuck. So how does this fit into the overall scheme?
We get clients from all different phases in life and in treatment and in addressing their health and well-being. And so some people will come to us in distress, in crisis, and they've tried everything else and nothing's working, and medications and therapies, and so this is like a last last option for them. And in those cases, we still say, well, I know you've tried all this, but you do need to continue to have another provider that's going to support you, because we're going to bring you in and work with you to address some of these underlying issues that are creating problems. But when you finish, we want you to move back and start working with your therapist again to continue integrating this experience. So it can fit into an existing treatment. We also have a single day option, and that's for someone who's actually functioning pretty well, and they may have just had a big change in their life, like a divorce or quit a job, and they're looking for maybe just a shift or some new perspective. And so ketamine can also fit in that sort of situation. And again, we would ask that you have a provider outside of here that you can go back to and continue to integrate the experience you had here.
Okay. We talked a little bit about the different ways that ketamine can be administered. With the IV infusion and intranasal being a couple of options, those that are not offered here, could you expand a little bit on why you've chosen to do the oral and intramuscular specifically?
With IV, you're required to have like an IV pole and the infusion drip, and it can be a little distracting in terms of the experience you're trying to have. So with psychedelic medicine, set and setting are key terms and really important things to attend to. And so setting is, where you're doing it, what the room is like, what the environment is like. And having an IV drip can sometimes be distracting or medicalize the process, and we just didn't want to do that. We're really trying to help people engage in the natural surroundings here and the environment, get outside when possible. And so that would have been a barrier. And then intranasal, when administering intranasal, it is hard to get that accurate with every patient, get the dosing accurate. And so we just opted to not go with the unknowns in terms of that dosing. So
that makes sense. There's a lot of reasons, and it's clear to me from being a patient that the comfort is a huge part of this exploration, I guess, and the journey that people go on. And so, not having a medical line attached to me, I think was a really important part, but also just knowing the people I was with, understanding the environment, and feeling fully comfortable was a really important part. And I think it really allowed me to get places I wanted to go, or needed to go, probably is a better way to phrase that, much more easily without distraction. So I agree with that, and I think it's smart. So I'm sure that people have concerns or questions about this. It seems it's new, and I know there's a lot of questions around it. What are some of the questions and concerns that people bring to you when they call?
Cost is a big one. How much is this going to cost? How much time do I have to commit to it? Do I have to take time off of work during this? There is questions around, like, am I appropriate for this, based on my age or my mental health background or the medications I'm taking, or diagnoses. And those are all, we do screen. We have a questionnaire that we send out early in the process to screen for some of those things. And so we can get back and say, well, you may not be appropriate for these reasons. Or, yes, it looks like you could be a good fit, so let's get you in so we can talk more.
Okay. Are there side effects or risks that they're concerned about that you have to talk through?
Yeah, with ketamine, the risks and side effects are pretty low compared to with some other psychedelic medicines. One of the biggest ones is hypertension. And so we do have to screen pretty heavily for anyone who has hypertension to make sure it's well controlled. But that hypertension and then cardiovascular issues, those are the key things with ketamine. And we screen pretty heavily for those issues or work with other providers like a cardiologist or primary care, to make sure that they feel comfortable that clients are pursuing ketamine treatment.
Now, correct me if I'm wrong, but ketamine's been around for quite some time, so it's well known and accepted amongst the medical community. Is that true?
Yeah, it's very safe. Like, in general, incredibly safe, and it's used in the ER all the time for procedures, especially for children. So it can be used in all kinds of environments safely.
So any of the contraindications are well known, and it's pretty straightforward for a patient to come forward and tell you what medications they're on. It's safer than most other options that we have. We know it well enough to know whether they're going to be undergoing any danger in this therapy. That's a fair statement. So one of the problems that people talk about a lot is the concern for being able to pay. It's seldom covered by insurance at this point in time. Is that something that comes up, and how do you address that with your patients?
Yeah, that comes up a lot. So we do not work with insurance, but what we can do with patients is provide what's called a super bill, and many different components of our protocol can be covered by insurance. So the medical psych screening to begin with, the regular therapy sessions, those all can be covered just as they would be outside of ketamine-assisted therapy. So it's just the day of ketamine that may not be covered by your insurance, and so that could be out of pocket. We do provide what's called care credit, and so clients can apply to see if they can get credit to undergo the protocol, and then they can pay off that credit over a certain amount of time at zero interest for 18 months. So that's helped with accessibility for a lot of clients.
Related to the cost for ketamine, some people would consider the total price kind of expensive. How would you explain to them what's involved and what's included in that price?
So our protocol is 4 weeks long, 4 sessions of ketamine, and that includes the cost includes the pre-screening with our nurse practitioner, all the appointments with the therapist, and so that's around 20 hours of therapy with a therapist, and then a follow-up appointment with our medical provider, the nurse practitioner. And so it is an intensive treatment, so I would equate it to doing something like intensive outpatient or something like that.
So it's more that they're looking at the combined total of a lot of hours and the medication, and it's all inclusive when we provide a price typically.
Yes.
Okay. Great. So let's back up to depression for just a minute. That's one of the key topics here. How does ketamine therapy compare to other medications and treatments for depression?
For depression specifically, we have a handful of medications, SSRIs, SNRIs, and some mood stabilizers that can be effective for managing symptoms of depression, but they are not addressing any underlying cause for the depression. And then there's other forms of therapy that can also be helpful and effective for managing depression. The thing about using ketamine and ketamine-assisted therapy is ketamine alone has an antidepressant effect. So for anywhere from 24 hours to a week, maybe more, the effects tend to build and are cumulative with repeating doses of ketamine. But for that amount of time, you have relief from depressive symptoms. And you also have increased neuroplasticity and ability to create new patterns and thoughts and behaviors during a window of time after ketamine administration. And so particularly with depression, where you may be stuck in these thought ruts and distorted negative distortions and thought patterns, you get a bit of a reprieve and a reset and a clean slate to develop new behaviors and patterns to support healing.
Mm-hmm. And its assistance in therapy also allows some patients to work at the core issue rather than necessarily just addressing the symptoms. Is that a fair statement?
Yeah, and And oftentimes, though clients may not recognize it, there are prior traumas, or there's big T's, little T's, but relational traumas, a really terrible relationship where you may have experienced what you don't call abuse, but it was some form of emotional abuse, and you're still healing from that, and that impacts you day to day and how you interact with other people. And so bringing ketamine into the treatment maybe bring up some of those issues that you can process and resolve.
Is this a first of its kind approach? What I'm getting at is the use of psychedelic medicine and ketamine in particular is opening up areas of the brain at the same time, and then allowing therapy to be almost expedited in many ways. It speeds things up, and it's a tool that I guess you haven't had for a long time, and I wondered if there was anything like it prior.
Well, MDMA, before it was rescheduled in, I think it was 1985, MDMA was being used in a therapeutic context for folks to, in a similar fashion. So before it was known as MDMA-assisted therapy, it was being used in that context. And I would also say that there was research going on back in the 60s and 70s with LSD in a similar platform. So no, not necessarily the first, but it is what some call the psychedelic renaissance, where we're bringing these medicines back into the forefront of use in psychiatry.
How many treatments does it usually take to be effective?
It depends on what we're treating. Most clients, we will start with the recommendation of 4 sessions. And that seems to be appropriate for many. But if you're dealing with, like, say, a complex PTSD, so early childhood traumas, that might require a couple of more sessions off the bat, so 4 to 6 sessions. And then, some people may continue to do like a session once a month or every few months to continue to work through issues.
You mentioned earlier that you offer one-time treatments. Who would be a good candidate for that? And, how do you see those used here?
Our one-day treatment is appropriate for clients who are already engaged in a therapeutic process, have a therapist or some sort of support system, and they're doing self-care. They're looking for maybe some sort of like perspective shift, or they're stuck in therapy and need to get unstuck. So something that's going to be a catalyst for movement and change. And this is someone who, a single session could be supportive and beneficial. If they were wanting to address chronic issues of trauma or depression, we would probably recommend that they do more than one session.
Okay. And how can patients prepare for their session?
We provide a preparation and aftercare guide to all of our clients. Appropriate preparation would be looking at from a holistic perspective, things in your life that may be keeping you stuck or unhealthy, and that could be substance use. So looking into substance use, how much are you using alcohol or cannabis, and is that something that should be addressed in this process? Also activity, exercise, diet, and stressful relationships or environments. Could be work. So we like to guide folks to do a global assessment of what's going on in their life, and are there things that might be helpful to attend to during this process. We also encourage folks to reduce alcohol, because alcohol and ketamine don't mix, and so we need clients to abstain from alcohol for 48 hours before and afterwards. So we do provide support with clients to get to that point if they need that.
I noticed for me personally, when I came for treatment, I like to compartmentalize many things in my life, but it seemed very important for me to leave my work life at home travel here and really set aside the space for treatment. And it seemed to, for me, it seemed to really help. It made me feel like I was being an active participant, that I really had made myself important enough to carve out some time to go through this treatment. And it certainly was beneficial. And then when you think about when someone's had the treatment, how they behave, or what they do, I should say, after treatment is also important. How should patients handle themselves, or what should they do after treatment?
So after, and I should have mentioned this in the before, but also we do encourage developing some sort of relationship with nature if you don't already have that. And so that could just be sitting out on your porch every morning while you drink your coffee, just trying to slow down and drop into that space in whatever manner or fashion might fit in your lifestyle. Going for walks, spending more time out in the woods or at the lake. But building that into the process is an important component of the healing process. And so, and you're asking afterwards, so after a session, we do want people to have like low stimulus, low stress. If going home is going to be, if that's going to be a stressful environment, then we would say maybe you should just book an Airbnb here and spend the night and go home the next day. We do want clients to integrate their experience, and that could be through movement, through going for a hike, through journaling, through creative process of writing or music. So opening up some space and time for that to happen in at least the 24 hours after the medicine.
Okay. So, integration, you just mentioned that. How would you describe that? What is it?
Some people think that all of the magic and action is with the medicine, and that's a big component. But if you have that experience and don't integrate it into your daily life, then you may lose some of the lessons and perspective that you gained. Mm-hmm. And so integration is something that the therapist supports you, bringing the messages and the things you might learn from that session, or the questions that come up. How do we attend to those and use those for learning and healing? So that's integration and bringing it into daily life afterwards.
Okay. When is it time for somebody to consider psychedelic medicine?
The more we learn, the more we see that range is very broad. We're outside of mental health support. We're seeing efficacy in traumatic brain injury because of the neuroplastic abilities of psychedelics, and also post-stroke patients. So there's such a wide range of usefulness with psychedelics that I think if you're struggling with mental illness, or not feeling well, or just feeling stuck in your current path, then all of those would be reasons to consider it.
Thank you very much. It's been really informative and a great opportunity to have people learn a little bit about some of the things that are going on in psychedelic medicine, and especially here at Asheville Integrative Psychiatry.